Okay, we're going to talk about the seventh type of diuretics. Okay, so the seventh type of diuretics is known as the osmotic diuretics. So several simple hydrophilic chemical substances that are filtered through the glomerulus, such as mannitol and urea, will lead to diuresis. Okay, so this is urea actually, the chemical structure of urea. So filtered substances that go through minimal or no reabsorption leads to a higher osmolarity of the tubular fluid. Okay, so when they pass through the lumen, okay, and there is no or very little reabsorption going on, so there will be a lot of so we'll have mannitol, urea stuff, okay, in that urine. So that's going to lead to that part to be very osmolar. Okay, it has a higher osmolarity in the tubular fluid, and that will prevent water reabsorption, okay, because of the higher osmolarity. So instead of being reabsorbed, it's going to absorb further water, okay. So that leads to osmotic diuresis, okay, osmotic diuresis. So water is going to just go out of the body, okay. And in this, when using this kind of diuretics, okay, only a small amount of additional salt may also be excreted. So using mannitol is not beneficial for treatment of conditions with sodium retention, okay, because osmotic diuretics are used to increase water excretion rather than sodium excretion, okay. So if you want to excrete sodium, it's not suitable for you to use mannitol or the osmotic diuretics, rather because it's more on what it does more is it excretes water rather than sodium, okay. So osmotic diuretics are used to maintain urine flow, okay, maintain urine flow after an acute toxic ingestion of substances that are capable of causing acute renal failure, okay. Because if someone ingests, okay, a toxic substance that can injure your kidney, okay, can cause acute renal failure, so it's useful to give osmotic diuretics because you want to maintain the urine flow, okay, because there will be lots of urine coming out with osmotic diuretics, okay, so a lot of water there. So osmotic diuretics are a mainstay of treatment. So it's a mainstay of treatment for patients with increase in the intracranial pressure, okay, increase intracranial pressure. So you have increased intracranial pressure due to whatever, maybe because of there is trauma or something. So you have increased intracranial pressure. There is bleeding, hemorrhage somewhere inside there, okay, or maybe there is a tumor or something. So increased intracranial pressure, or when you have acute renal failure, okay, due to shock, for example, maybe a hypovolemic shock, okay, not enough blood going to the areas, not enough blood going to the kidney and other areas, and if you have drug toxicities and so trauma like this, motor vehicle or road traffic accident, so it will keep urine flow, okay, and that will preserve long-term kidney function, and that might save the patient from having to undergo dialysis, okay. And mannitol must be given intravenously and not because it is not absorbed orally, okay. It's not absorbed orally, so we have to give intravenously, okay, not so difficult to understand. So the adverse effects or the unwanted effects of mannitol includes extracellular water expansion, obviously, okay, dehydration because of so much water coming out, and then hypo, right, or hypernatremia. So it's easier to remember. It's hypo or hypernatremia depending on how much water is coming out. So mannitol being in the extracellular fluid, okay, will lead to water being extracted from the cells, okay, because if we have a lot of mannitol in the extracellular fluid, so water will be extracted from the cell outside. It will go into the extracellular fluid, and that will lead to expansion of the extracellular water, and we will look at hyponatremia until diuresis occurs. Okay. So this is an example of a vial of mannitol injection, okay, that can be given. So yeah, so that's all for this part. So we might continue next time with the other drugs. Okay, see you next